My name is Asma Arshia, but I go by Arshi, and I'm a PGY3 resident at the University of Kentucky, and I will be an incoming fellow at the University of Michigan in 2025 in cytopathology. I want to do this just like any other panelist did. I'll go through the questions and then answer them to my best knowledge. So the first thing that I would like to say, the first question is like, what factors to consider when you're choosing pathology? So I'd like to say to anybody who has this misconception that, you can interact with the patients or anything like that, or somebody who's very passionate about the patient interaction, this field is not for you for sure, because you have a very limited patient interaction and there is no direct patient care. Just like earlier, the radiology panelist mentioned, how you're like they will interact with the patients, but for us in pathology it's more like very limited, especially in apheresis, and then cytopathology you go on procedures and all that, but there will be very limited interaction with the patient. But if you are like Dr. House, if you want to play Dr. House and just not interact with the patients and just do the diagnostic challenging aspect of it, then this field is for you for sure. And then the next question that I would like to answer is, a typical day in the life of a resident, especially for us, depends upon the rotation. We have different rotations, which are like some demand a lot more work than compared to the others. For example, like in search path, because if you're doing AP-CP residency, AP rotations require you to put in a lot more hours than the CP rotations. So in anatomic pathology, of course, a search path is the most heaviest of all. Like my work day in a typical search path rotation goes like we have 1 day cycles, which means we have to preview the cases, we have to sign out with the attending and also gross everything on the same day. And some programs have it like a 3 day cycle where they distribute the work in amongst 3 days and then the cycle repeats again. So for us in our program, we have 1 day cycles where in the morning you sign out with the attendings with all the cases that you have previewed the previous night. So actually my workday begins at 7:45 in the morning, which we'll have 1 hour of didactics, and then you sign out with the attending. And then we, in the afternoon, there is not specifically a lunch break or anything, but it just depends upon how you organize your day. You can take a little bit of break and then have lunch and then go up for grossing the specimens, and then it goes until like 5 p.m. or 6 p.m. depending upon how much you have on your bench. And then and after that you can just take a little bit of break and then go back to your previewing the cases, and sometimes the day ends at 9 or 9:30 in the night. So they can be really long days and long hours. But if you're on a CP rotation, for example, like a blood bank rotation or on a micro rotation, so your day, again, it starts with the didactics, but then the day will not be as long. It just goes until 5 o'clock or 4 o'clock, depending upon what you have to do that day, like if you have any assignments and things like that. But those are the days that I would definitely take advantage of and read more upon and learn. And it depends upon how much work you put in is what you get out of it, right? So as other panelists have mentioned, how much ever if you work hard during the residency, then you will be less likely to make more mistakes after you come out of the residency. And when you're working as an attending, it will be much better on you. So yeah, that's how my day goes. Then the next one is the work-life balance, of course. So it's favorable comparatively to the other fields, definitely, I would say, and also depends upon the private practice versus academic. So if you're in an academic setting, definitely your time will be distributed between like teaching, education, research work, and also the clinical work that you're doing. So it depends upon like if you are going into the private, obviously you're expected to do more work, and there is all these other things that the research, teaching, and spending time with the residents and all will be reduced. Obviously you'll be earning more money for a reason, because you're looking at least 200 to 300 slides a day. So it all depends upon like whether you're going into a private versus academic, And also in our field, we have more of a predictable hours, like, you choose to work how many hours you want to. And as a resident as well, we have like Saturdays and Sundays off. So that's a good work-life balance, I believe. So we can catch up on anything that you like, your hobbies and things like that, along with your reading and everything on the weekends. So that's good. And we have less number of calls when compared to the other, fields, and it's a more structured schedule for sure. So that's about the work-life balance. And then the next question is, yeah, salaries ranges after the residency. So it depends upon, like, suppose you're on a visa and you have to get a waiver job. I think the most of the waiver jobs, they start from like 180 to 200K on an average in a remote, like US state, somewhere like if it's a malignant. That's what right now the salaries are. But again, like if you can get a good waiver job, the salaries can be from like 200 to 250K, and in an extremely like rare cases up to 300K as well. So and also, like if you are going into the private setting, then you cannot get a partnership until you get a green card if you're on a visa. Even in that case, like if you will be starting your salary from like 200 to 250K in the beginning, like for the first 3 years, even in a private setting, where you will be like, obviously you'll prove, that you are capable of that partnership or whatever. They will not give you partnership right away, but the first 3 years you have to prove yourself, and then from there, like, the partnership will be offered once you get the green card. And obviously, when there is a partnership, you will earn more, like from 400K to up to a million as well. There is a potential, but then the problem is, you're also risking it, like you're investing your money in the partnership, right? Like, obviously, if the practice goes well, then you will be having good returns. But if you do not, then obviously you're losing your money as well. So there is a risk. And also the number of hours that you put in, that how much you earn. It's not like you work less and you get more money, right? So that is a very important factor over there. And also depends upon the academic versus private setting. Again, the salaries can change. In academic setting, you have obviously less amount, like 190 to 200K is the beginning, when compared to the private. And also geographical location matters. Some places they have, like, very high cost of living, and so obviously salaries will vary based on the location. And also it depends upon your negotiation and your skills and things like that when you're interviewing for the jobs, and how it aligns with the needs of the institution. It all depends upon those things, for the salary and everything. The next question is, yeah, obviously options after your residency will be, a lot of them, like, choose to do a fellowship. Like anesthesia, we also have like only 1 year of fellowship, like, so people can choose to do one fellowship versus like two fellowships. But nowadays the trends are changing from two to one because of the good job market. And so people go choose the fellowship, or they do the waiver jobs, or go back to the country, if they're on visa, of course, and then come back on H1 again. Or if you are from a Middle East or something, like Dubai and Qatar are really good places, with the equally competitive salaries, and obviously there is no taxes there. And Canada is another good option to go to, and any other like English-speaking countries like Australia and New Zealand, you have opportunities with the US residency. And also in European countries, you have good opportunities as well. They have comparable salaries too. So those are all the options that you will have after the US residency. And coming to the fellowships as well, like you have a lot more options like heme path, derm path, and cytopathology, so surge path and cardiopath, and all these different fields to choose from. But again, like there are some fellowships that are very competitive when compared to the others, just like in any other field. And you have to, show your passion towards it, and obviously work on some publications and research and things like that. Obviously, networking goes a long way. Letters of recommendations for sure. So yeah, and I'm also on the committee for choosing the upcoming, residents in our program. So I see that a lot of people who have done observerships or rotations with us, we tend to kind of see them in person and then kind of get an idea about how that person will fit in a group of residents. So the teamwork and all these things matter a lot. Teamwork skills and how willing are you to help. That's very important because in pathology as well. Some days can be really very tedious, and sometimes people have to cover for each other, and they obviously look for the teamwork. That's very important. So those things are very like being, first of all, having a good academic record, and being good with all your attendings, having good letters of recommendations, research and publications, networking, going to the conferences. So all these things will make you more competitive in your application for pathology, for sure. And the next question is, how involved are you in the research as a part of your current residency? I would definitely say that, like I mentioned earlier, we have some lighter rotations or lighter like CP rotations and all, where you will have more opportunities to do more QA projects or work with your attendings one-on-one, to come up with a project or poster presentations or, to the ASCAP meetings and things like that. So I do get opportunities from time to time to work on my publications and research. And I make use of those lighter rotations, especially the CP rotations, because AP is really heavy with the workload and everything. So I usually don't find time during those rotations. And then, yeah, so in what, so the next question is like, how welcoming have the other residents and attending physicians have been towards you? Yes, I feel like in our program we have a more collegial environment and very like diverse people. My program has a lot of people from like India, Pakistan, Egypt, and like many other places like Caribbean, Africa, and all. So it's like a diverse cultural environment, and it's very supportive and very nice. Especially amongst all the other fields, I feel like pathologists are the most nicest people I have met. They are very, very friendly and easygoing, and we all have like a kind of rapport. And I really enjoy being in this field for sure. And my favorite aspects of being in this field are definitely the intellectual aspect of it, the diagnostic challenging of the solving a case, and then the second is like collaborating with the different clinicians and radiologists. Especially when you're going for the cyto procedures like FNAs and all, you will have direct interactions with the radiologists where you're working on the procedure, and the variety of fellowships opportunities that you have, and the opportunity to work on the research, teaching, and education, and things like that. Those are all my favorite parts. And the least favorite, if I have to pick, so that would be like, obviously, just like radiology, it's underappreciated. So that's what I feel like it's common.
So I graduated from Aleppo University in Syria Medical School, and I did also a clinical pathology training in Syria, like for 3 years before I moved to US. In US, I worked in research as a postdoc in Case Western University, and 2 years in Cleveland Clinic as a researcher before I started my residency in North Carolina, Wake Forest in pathology. It's APCP program, anatomical and clinical. So it's 4 years of residency. And then I did 1 extra year, it's fellowship in hematopathology. And that was in Baylor, Houston. And currently I'm basically working as a pathologist, hematopathologist in a private practice group in Seattle. Oh, okay, awesome. So yeah, regarding like if you want to know like how you basically need to get into pathology, first of all, you should really have a genuine interest in it. It's way different than other specialties, as you can tell. Like we don't really see patients most of the times. I mean, we see sometimes when we perform FNAs, so sometimes we see them, but it's not that common. Most of the time, you are basically working with your tissue, which basically is a patient. So we always value that. When we're looking at tissue, we know there is a patient behind it. We try our best, basically, to give the best care. So it's really important to have a genuine interest in it, because it's kind of different from the other specialties, as you can tell. And basically, when you apply for pathology, you need to show that in your CV, in your personal statement, and especially in your CV. So easily they can program directors will basically know if you're genuinely interested in the field or not. If they see like, oh, you've done like IM rotations, and then there is one rotation in path, this is not going to basically attract them. So they want to really see that genuine interest in your CV. Like by doing rotations, I didn't really do much rotations in path before I matched. I did a few in Cleveland Clinic, but my research has a lot of was extensive, and I think that helped me part of it. It didn't help being a clinical pathologist in Syria back home, but because they don't really look at your CV back home. They care about what you're doing in US in terms of getting into a program. I got many interviews in path, and I choose North Carolina. So regarding fellowships, I think it's very important also to know what you're interested in path, especially after the first year. And if you're interested in more competitive ones, like such as derm path, it's really good to start in your first year, like talking to mentors and the specialty, because it's very competitive, and you're competing derm residents as well, because both can go into derm path, dermatology residents and pathology residents. So it's kind of, if you're interested in that competitive one, then you go start working on it the first year, or even before you start your residency. But if you're interested in other fields, and you can tell, like I never thought about heme path, but after a couple of years of training in pathology, I found it fits me the best. Lifestyle in pathology, I think it's like in residency, it's a reading residency, basically. It's a lot of reading, a lot of learning. You would feel yourself you're back in school. You feel like you don't know a lot, which is a very interesting feeling, that you feel like you know a lot, but then when you start residency, you feel like, oh no, I don't know anything about pathology. It's really a lot of topics, and especially here in US, they do anatomical and clinical together. Back home, like we do AP on its own, it's 3-4 years, and another 3 years in CP if you want to do it. But here it's together, so you're doing clinical pathology and anatomical pathology and forensic medicine at the same time in 4 years. So it's ton of information you have to grasp in 4 years, and that's why the extra 1 year fellowship become very important, to basically get to know more about one thing that you didn't get to know much. And especially now, every subspecialty in pathology is expanding. Like heme path on its own, it's 1 year even fellowship is probably not enough. You probably need 2 or 3, but you would learn also while you're practicing. You're like, oh, this is I never seen. This is like, so you keep reading even after you finish your training and everything. It's very fascinating how much information now, like these fields expanded. And anyways, so after you choose what you want, your fellowship, you also need to choose the kind of environment you want to practice, like academic versus private. And in pathology, probably because since most of the programs, like 99% of them are and in universities, so it's not community hospitals, so you probably won't get any exposure to what private practice mean in pathology. And until you probably, when you start looking for jobs, it's like, oh wow, there's a huge difference for sure. So academic, you're gonna teach residents. It has more exposure to medical students and also residents. You teach residents, medical students, whoever rotating. So it has also some kind of I would say flexibility at work, more than private. But in academic, you feel like you're, even if you're on vacation, they're going to call you, they're going to bug you, and they're going to ask you questions. But in private, it's more, I would say, once you're done, you're done. You're out for work, you're out for work. You do your job and you go home. I have a good lifestyle balance here. I feel like like I start by 10 my work, like, you know, I don't see patient, right? So I can come over whenever I want, as long as I finish my cases within, you know, work hours, and usually finish by 4 or 5. So I feel like it's good work load. In academic it's kind of similar, but it might be, you might, you know, you have other duties like you know, teaching and writing research. So the practice is kind of different, more complicated cases in academic, so it might be more fun in that aspect. We consider it more fun when it's more complicated, but it become a headache sometimes when it's more complicated. In private it's more the, you know, bread and butter pathology, and you get some interesting cases every while, every once in a while. Yeah, but a residency lifestyle, I think it's probably, as I said, it's reading residency. You have to have a plan, studying plan. I would say in the first year, you probably need to survive it just to understand the field and, you know, start to see what's normal, what's not normal, I think. And then when you are in second year, you really need to start reading in depth and have a studying plan to be competent pathologist at the end, and also to pass your boards. Passing the boards is something not, I think it's not as easy and as other specialties. The reason is because, as I said, you really feel like you don't know much when you start residency. So reading is important in pathology. That's what we call it, reading residency. So you have a plan and revisit that plan and keep going with it until you reach the last year. Don't just study in your fourth year and think that would be fine, because it will put a lot of pressure on you. A lot of topics to read in 1 year is too much. And also, you know, knowing things in advance in training basically will get you the like the benefit of this knowledge. So you learn something and then you see it. That's it will make you feel better about yourself even. And also I would say and yeah, keep like just learn from everybody. Like techs will teach you stuff, your seniors will teach you stuff, your attending will teach you stuff. Take advantage of all the resources in residency, like all the materials you get. You have survey slides, have unknown sessions, you have didactics. You take all the opportunities to learn from it, because it's your time to learn. After that, probably we become difficult, you'll be on your own probably. So it's very good to take advantage of the resources you have in your residency. And yeah, be humble, open-minded, and you'll get there.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.